So nobody likes the surprise medical billing. But what are some of the unintended consequences of President Biden's plan to fix this problem? So I want you to picture this. I want you to picture that you have an emergency, you've broken an arm, and you go to a hospital that you think is in network, meaning that your insurance company has already contracted with that hospital and your rates have already been determined and you shouldn't be getting any surprise bills later. So you go into the emergency room and they do x-rays and they do all the things they need to do, and then you need to have a surgery and all this stuff. And it turns out that the emergency room is in network, but the particular orthopedic surgeon who's on call, who came in at midnight to fix your arm, he is not. And so months later, you get a bill for $20,000 to cover the orthopedic surgeon's time that he spent to fix your arm. And you say, hold on, I was in network. And it turns out that you were for the emergency room, but not for the orthopedic surgeon. So that's surprise medical billing, when you think you're doing everything that you should, and you have to get services done, and it turns out that one or two of your specialists, or one or two of the facilities that you had to use, or one or two of whatever wasn't covered, and now that's on you. And that contributes to medical bankruptcy and all sorts of horrible things. It has to be corrected. But I want you to think about the other side of the coin. So I want you to picture this. You're the orthopedic surgeon. It's midnight. You get paged to go to the hospital because somebody has a bad broken bone that's sticking out of their skin. It's an emergency. So you go in, you drag yourself out of bed, you go into the hospital, you spend 3 hours in surgery, fixing it, post-op, all of that stuff. You get to go home, you get to sleep for 1 hour before your regular shift starts. And then 3 months later down the road, you learn that those services, that what you did, all of your time and effort and skill and lost sleep and annoyance of your spouse and all of that, you don't get paid a dime for it. Because it turns out that you're not in network for this patient's service. And you had no idea. And as the on-call doctor at the hospital, you have no choice. You can't say, oh no, I'm not going to go in on this one. You're the on-call doctor. So it's very unfair for a patient to get a surprise bill because one or two of the specialists or services are out of network when it's an emergency and you don't have time to shop. But it's also very unfair to the orthopedic surgeon who spent years getting to the point of being able to fix this, getting out of bed in the middle of the night, doing all the services, and not getting paid a dime. Now the government, we all know that the government has a very unfortunate history of making one-sided policy decisions, kind of like they did in 1986 with the emergency room, where they have to treat anybody who comes in. And because of that, over 50% of all costs in the emergency room never get paid because the people can't afford it, or they don't have insurance. And so the rest of us who have insurance end up paying for them. And still, the hospital, well, they end up losing a ton of money because Washington did not have comprehensive thought enough to do something that sounds good, right? If you're in an emergency, they can't check your insurance first, they have to keep you alive. That sounds really good. But they didn't think about it long enough to think about the unintended consequences. And if President Biden doesn't have a comprehensive, well-thought-through strategy on this stop surprise medical billing that he wants to enact, then it's going to put more and more weight on the healthcare system, on the healthcare providers. You see, if physicians were allowed to strike en masse, if it were legal for us to do that, we probably still wouldn't do it because it would mean thousands and thousands of people would die. We have a heart. But we keep getting piled upon by these horrible, one-sided legislative policies that come out of Washington, D.C. from a bunch of bureaucrats who aren't thinking about the whole situation. And even though we can't strike en masse, our numbers are shrinking drastically. They're shrinking through depression. They're shrinking through statistics like 50% of us are burnt out. They're shrinking through at least one physician a day in America kills themselves from suicide because we can't handle it anymore. So while we can't strike en masse and say we demand that you stop abusing us, it's kind of happening slowly. More and more and more of us are not able to practice anymore. So I'm urging President Biden, and all the lawmakers who are listening to this and all the citizens to say, let's start thinking about comprehensive, well thought through policies that can be not only fiscally conservative, but also socially responsible. And if you look at both of those for all parties involved, the patient and the providers, you can come up with the equitable and sustainable solution where partisan politics are shoved to the side for once, and perhaps the health of the patient and the health of the provider can be thought about so that our system can thrive, can be healthy. So if this stop surprise medical billing goes through without considering the other side of the coin, yeah, you might not have any surprise medical bills anymore. But the surprise you're going to face, well, there's not going to be any healthcare providers left to treat you. To learn more common sense solutions, to learn how you can personally get involved, and to be the change you wish to see in the world, subscribe to this channel, and we'll let you know when new videos are out. Please also check out the book I wrote, Universal Death Care, a solution for healthcare in the age of entitlement.